saw like the PTSD that are still like the post-traumatic syndrome, stress disorder, and even in children we see like what's going on. And I have many parents who approach as well, who asked about their kids, and they are worried about themselves, about their kids. They start to like feel different symptoms that they didn't, like fears that they didn't have before, maybe some memories of the war as well. So we will talk about all this today with Dr. Jeremy, and you are free to ask all your questions on the chat box. So without further ado, I would like just to give the floor to Dr. Jeremy.
Hello. Hi, Randa. Thank you very much for the presentation and for giving this opportunity here to talk about a difficult subject, but in terms of trauma, but more importantly, talking about the recovery side, really of trauma. So what I did is I've prepared a presentation with different slides. I'm going to just upload this so that everybody can see, and then I'll just start going through it step by step. Any questions that you may have along the way, you can just send your questions directly in the chat, like Randa said, and I will answer them either as I'm talking, or I will leave it at the end once I've finished going through the presentation. All right, so let me just start this now. Okay, so just wondering if everybody can actually see.
Yes, we can.
Yes, they can. Great. Okay. So recovering from trauma. Here I just presented a little disclaimer. Basically, it's just to let everybody know that the knowledge, the information that I'm going to be sharing today is based on all evidence-based knowledge that we have on the field of trauma in mental health. We need to also know that what might be effective to some people in terms of therapy approaches may not necessarily be the right thing for another. So I'll elaborate more on this as we go along. There's continuous new research being done in the field with new findings, which means that what we may think is effective today may not be in the next few years. But so this is really all the newest interventions that are used today that we know are most beneficial. So again, new information is always coming up, so there's no really hard fact for treatment of trauma for all. It's not like one shoe fits all. There are some approaches that some people will benefit from more than others. So I hope that what I'll be sharing today you will be finding helpful and and useful along the path of recovery. If there's any questions, obviously I'll be able to answer them as we go along towards the end. And then if we don't have any time left and you still have some questions or any questions you'd like to be asking in private, you can always do that by sending an email to the email that's just there on the screen. Okay, so I know that many of you have been a witness to the recent event, recent devastating event that happened in Beirut, that really shook the lives of many, of everybody there, and also of people around the world who have also been affected by this. You know, trauma is something that we are all going to be experiencing somehow in our lifetime. This is something that touches all of us, and there are many forms. There are people who will be able to develop coping skills that will allow them to adapt and carry on their life in constructive ways. And then there are other people who might struggle much more than others. And that's where we enter into more serious conditions. So here's just a few statistics that you might find interesting. Is that, first of all, most people who experience a traumatic event don't develop PTSD. There is a strong correlation between PTSD and major depression as being a big problem around the world. And there is an estimation of about 354 million adult war survivors globally that suffer from PTSD and or major depression. And PTSD and major depression are the most prevalent mental disorders in war-affected areas. Again, we don't have like an exact prevalence. It's not possible to have an exact prevalence in terms of the number of people who will suffer from trauma in life, since it's something that we're all touched by in various ways, but not everyone will develop PTSD or another form of mental health condition. We know that people who do develop PTSD or other forms of traumas that are more serious that I'll be discussing now, many of them have comorbidities, meaning that it's not uncommon to be suffering from major depression or other forms of mental health conditions at the same time. So here we might be referring to addictions, we might be referring to eating disorders or other conditions as well as comorbidities. Okay, so these are, first of all, in the light of a trauma. First of all, it's always something that is a surprise. We never, it's unexpected, meaning that we don't know this is going to happen, and a lot of the time we will struggle with feelings of helplessness and hopelessness, such as there's nothing that we can do to stop it from happening. So this is like the three main components that keep happening over and over again, such as what's happened recently, but it's not limited to just that event. So the central theme, like I mentioned, is helplessness. You'll also have a sense of isolation and a loss of control. You will be feeling very unsafe and feeling a loss of power. So several types of trauma. So here we have an acute type, which is based on a single event. So it's a single event that's been very frightening and very, very difficult. Chronic is more traumas that are more persistent and recurrent over time. And they could be going over years, and is not necessarily something that is a result of such a disaster that happened on the 4th. This could be many different types as well. Here we might be referring to various forms of abuses and other forms of experiences, as maybe assaults or other forms of accidents. And then you have another type, which is complex, more complex, and has a longer history of many other forms of traumas happening together. So we use these different technical words. This is based on the classification manual for diagnosing trauma and stress-related disorders. So these are a few words that you might be familiar with. You might have experienced this. You might even have such a diagnosis yourself. And this is usually a team of mental health specialists who will be assessing you and come up with a diagnosis such as these.
So Jeremy, how long does it take to have a PTSD? Like, does it show immediately after the trauma, or does it show after a few months? Or can you talk more about PTSD, which is, for those who don't know, it's post-traumatic stress disorder. It's the stress symptoms that we have after the trauma itself.
Mm-hmm. Yeah. So just down as we move through the slides, I'll be mentioning a little bit more of PTSD. But yes, PTSD is the technical, what it means is exactly as you said, post-traumatic stress disorder. It's not because you've had a traumatic experience or very frightening and devastating personal experience that means that you will automatically be subject to having a diagnosis of PTSD. Now, symptoms you can usually, normally to get a diagnosis of PTSD, we're looking at a prolonged state. So this could be after maybe a few weeks, 3 weeks, maybe up to 3 months of continued experiences of certain symptoms that you're unable to overcome, which is what I'm going to talk about in a moment. So as we go down the slides, I'll be showing you a little bit more about what those symptoms are. And maybe if that's something that you relate to, then that would be an indication of seeking help.
Okay, we have a question just from Lara. She's asking, what is comorbidity?
Okay, so comorbidity is a word we use to say that we'll be subject to suffering from other mental health conditions at the same time. So we will have like maybe a primary diagnosis, but then we will have maybe other diagnoses as well. So it's not uncommon, for example, to be suffering from PTSD and some major depression, or maybe addiction, or eating disorder, or other forms of anxiety disorders as well, or personality disorders as well. So that's what the word means. So these are the different sources of traumatic experiences. Now, what is traumatic to one person might not necessarily be traumatic to somebody else. So it's not a rule, because we all have different constitution. So this is important to highlight. It's not like a rule that's what everybody's going to go through. So we also have different ways of adapting to situations. But different forms of trauma usually will be the result of such examples that we have written here in the list. So that includes like natural disasters. It could be illnesses with the death of a loved one, or it could be accident, and as you see here, other people might have been exposed to a series of these experiences, not only one time, maybe multiple times, maybe many times over a few months, a few years, or since the beginning of their life. So here we might be going all the way as far back as early childhood. And so that becomes that can become more complex. These are the typical emotional symptoms that a person who's experienced trauma will be displaying for any of the types of, let's say, classified diagnosis. Will experience these symptoms here. Meaning, even if someone's experienced a very difficult and horrific experience, right after the aftermath of such a difficult experience, will be experiencing these emotional symptoms. So there will be confusion. We might feel numb, not understand what's happening. It'll be very, very difficult for us to focus. We might even feel guilt, irritability as well, in the hours and in the days following an event.
Okay, Jeremy,
Again,
I got just a comment that someone is not hearing you well. Is it possible just to raise a bit the volume from your device?
yes, I'll try and do that.
Yes, that's better. Okay.
Okay, so I'll just raise my voice a bit more, if that's okay.
Yes, perfect.
Okay. So those are the emotional symptoms, common emotional symptoms that we might experience, without missing on very common one, which will be flashbacks. And the word flashback means that we're going to be reliving the scene in our mind, maybe over and over again, which might happen at any time of the day, but it can also be happening at night, which can cause, for some of us, severe sleep disturbances. So this is also very common to be experiencing even right after the event. For a lot of us who are experiencing these type of emotional symptoms after a trauma, the symptoms itself can begin to subside naturally after maybe a few days, even after a couple of weeks. It might begin to subside, whereas for others, it can persist a little bit longer than this. Again, even if it does persist a bit longer, it doesn't necessarily mean that you're going to be subject to a diagnosis. So this is why this has to be carefully monitored, and then knowing who to turn to and who to see will be important. But as we continue, we'll be covering the other points later on. So physical symptoms, these are kind of very common physical symptoms we will have, such as fatigue, heart palpitation, maybe difficulties eating because of difficulties with digestion. We might be highly alert, or we say hyper aroused, meaning that you will have a sense of being in danger all the time. So you're on high alert, always feeling on edge. So again, that's going to cause your body to be very tense and to feel very rigid and uptight. Hence headaches and other symptoms like this. So you really feel the sense of being alone, even though there might be other people, but you're really struggling because it's really something that you're experiencing from within. And this helplessness, sometimes feelings of hopelessness, can be very overwhelming. And that's why it's important to know who to turn to. As mentioned before, some traumas will be isolated, meaning it will just be a single event and it just stops there. For other people, it may be repeated over time. And this might be happening, for example, if we're living in an environment where we might be subject to different forms of, let's say, verbal abuse, can also be something that will be very, very difficult. Now, for cases where not only we might be in such environment where there's such abuse happening, but at the same time, we happen to be subject of the disaster that happened in Lebanon. So we're adding more traumas to our life experiences. So depending on how I've been coping with the other traumas, it can also affect how I'll be coping with the other ones that I'm also being exposed to as we go along. So it can be very difficult. So just a bit about PTSD, so post-traumatic stress disorder. These are typical symptoms that we will be experiencing. So flashbacks, as I mentioned before, it's just a memory in which you are reliving, sometimes in detail, the experience, the traumatic event. It can happen at any moment, and it will really affect your sleeping patterns, which then in turn will can affect your functioning. So it will affect your work, it will affect your interpersonal relations. It just will affect your whole life. You will become emotionally more irritable, meaning that you might have angry outbursts. You might be overwhelmed very quickly. You might also notice yourself being more isolated than usual, maybe wanting to go out less. You might want to avoid going to certain places that you used to go to or walk to, for example. You might take a much longer road to get somewhere instead of a shortcut you used to take out of fear. So it's like you are just continuously ruled by fear. You might have feelings of numbness as well, and just withdrawing from anything that you used to enjoy as well. Then there's what we call complex PTSD. And complex PTSD is a relatively new term that has been used in recent years, simply because mental health practitioners used to see patients who would display many different symptoms that would look much more than just a typical kind of PTSD. And therefore, that's the word that came up and has been used more and more. We know that people with a complex form of PTSD, so people who've experienced multiple forms of traumas throughout their life, usually a complex PTSD is something that we notice starts usually in childhood. And for these people, they will have, or you will be suffering from sometimes severe interpersonal relationship issues, simply because it's a little bit like, as a child, you've been marinated in an environment of betrayals and feelings of deception, that's become the normal or the norm for you. So you don't know anything else than that. So it's not uncommon that you then find yourself in other relationships that kind of resemble the experiences that you've had when you were a child. So people with complex PTSD are 8 times more likely to develop many other mental health comorbidities. Again, the word comorbidities is just to say that many other forms of mental health conditions, personality disorder, other forms of self-destructive behaviors, which might be self-injurious behavior. These are maladaptive coping mechanisms. The word maladaptive is unhelpful ways of being able to survive. So even though at the core essence, these are survival mechanisms, they end up becoming destructive and unhelpful to our life. So it becomes problematic. And the recovery from complex PTSD is something that can take a long time, and really needs to be done with the right support, because first and foremost, when we've experienced a trauma, just let's say a single event, acute trauma episode, without talking about something chronic or complex, our sense of safety has disappeared, and that's really the base, the foundation of everything. If we don't have that sense of safety, then we won't really be able to function in a normal way, or have constructive or beneficial interpersonal relations. And it's just going to affect all our life. So this is the first thing that we need to establish. And if a person has been in an environment where, let's say, the basic nurture, basic forms of safety and basic forms of encouragement have been lacking, then there's everything to rebuild, or everything to build from this moment. And so therefore that can take a long time, as I might have mentioned. It's especially in terms of complex PTSD. It's like the child has been marinated for many years in an environment that's been very unhelpful and very, very painful. And so one's ability to regulate or to cope with our life is distorted, is impaired. So we have to relearn this, and it's through the help of a therapist who is skilled in trauma work that you can do this work, and it takes time. It takes time to build trust, especially when I've been feeling unsafe all my life, and I don't know what trust really means, simply because the people that I cared for the most happened to be the perpetrators themselves of my situation. So again, it's a process here to work through. So that sense of being alone and not having a way out is common. Just feeling not knowing who to turn to. Our life can appear very dark, and we can be very, very lost. Again, when talking about trauma, it's a spectrum, because there are many forms. As I said, there's over many years, and there's something that just happened, as what, for example, happened on the 4th of August in Lebanon with the explosion. So it's a big field. Yeah, it's a big field. So there will always be an event or a series of events, which will be the situation itself, that has caused great harm to oneself, plus the reaction. Now we will all react differently to an event, simply because we all cope differently, and the way that we react towards that event will determine the outcome. It will determine how we're going to continue developing afterwards. So what most of us don't realize is that most traumatic events are short, relatively speaking. However, the wounds of one traumatic or one acute episode can last a lifetime for some of us. And so for many of us, for most of us who are stuck, we just find ourselves reliving a past, and it's as if we are stuck with the past, and we don't have a sense that things will get any better, because I'm not having the right tools to be able to work through my struggle. However, the good news is that recovery is possible with the right steps, even though that can be a journey and a process. And it's never a straight line. Recovery is a path that, you know, has pins and needles, as we say. It's like peaks and valleys, so ups and downs throughout. So I'm not sure if anybody else has any questions before I talk a little bit more about recovery.
Yeah, there are a few questions on the chat box, so I will just go through some of them and then we continue.
Please, yes.
Okay, so we have a question from Emily. She said we have to go back to our daily routine, especially at the office. But personally, she feels that everything is kind of out of context and irrelevant compared to what we are going through in the country. How can we find balance or try to concentrate on the job that has to be done? So, you know, the trauma affects our concentration, our just focus. So we're not focused. So how can we just go through that?
Yeah, that's a very good question, especially if the political situation is unsettled. That becomes even harder to do. However, first we need to understand more about the reality of the situation. And that's where we'll be talking about adopting common sense. And, you know, common sense is very overrated. But at the same time, lots of us, you know, it's the foundation of everything. A lot of the time we won't necessarily know what common sense is, and we won't know how to use it. So this is what we need to look at. So common sense, meaning looking at the situation and as it is, the reality of the situation as it is.
But maybe that's also the problem, because looking at the situation as it is, it's huge for our brain to really grasp and understand. Like, it's too much. What happened is really too much. So how can we still focus on our daily life and on our job? Like, maybe separate it mentally. I don't know, like how can we just say, okay, now I want to focus on my job and not think of something else. And then, or I put a time slot, for example, I say, okay, I can ruminate about what happened for, let's say 30 minutes, and then I will just work again. So what is there any tips that you have for?
Yeah, of course. You know, there isn't, like I said at the beginning, there isn't like one shoe fits all. But I guess the advice that I would give to everybody is more about trying to center yourselves back within. Simply because we feel powerless and out of control when something is happening that's traumatic at an acute level, but also maybe at a much more complex level. Meaning that if I'm in an environment that's already very unsettled to start with, plus there's other events that are happening, so it's like I'm continuously exposed to very challenging an environment that keeps feeding into my sense of feeling unsafe. So it's very easy to lose focus. It's very easy to lose hope. So the best thing that one can do would be to focus on what it is that you do control. So what's the first thing that you can control that you feel is going to bring you some form of calmness and peace? Is it by looking at what's happening outside, even though that's sometimes unavoidable to do because we're part of an environment? But to help oneself in terms of, as you were asking, in terms of tips, to do even in such a difficult circumstance, especially when the situation politically is so complex in Lebanon, the best thing you can do is begin to look within. And to begin to apply different techniques, which I'll talk a little bit afterwards. This here, we're talking about things like mindfulness, breath work, practices like meditation. We can talk about these things afterwards, but those are great ways to ground yourself, to center yourself, to feel back in control, because that's the first thing that we want to really be focusing on. We want to be focusing on re-establishing some sense of safety within ourselves. And if we can't get that sense of safety outside, then we also have to be looking for it within ourselves. And I'd like to differentiate between doing that and doing what a lot of trauma victims have done maybe automatically in their life, which is what we call dissociate from an event, and then develop what we call a dissociative this type disorder, which is basically something very common for people who've been in abusive relationships. They will very often dissociate by escaping somewhere into their mind, so they don't have to be remembering and to be really a witness to what's actually happening right now. So that's another problem in itself. So here, the tips that I'm giving you is not about escaping from your reality. It's about being in control of yourself in the situation you're in, to bring yourself a sense of safety in a tangible and concrete way that will assist you in being able to complete tasks such as your work, even though the situation can be a very difficult one.
Okay, great. And so basically there's, this is a very good example. Thank you for that. So we have also Nema who's asking, how often should the emotional symptoms happen for us to know that we have PTSD and not just a normal reaction to what happened?
Usually when the emotions become severe, meaning that they begin to become very overwhelming for you, and you begin to feel like this is out of your usual experience, and that you feel that it's not subsiding, and you're starting to really be affected in your functioning, and that you're experiencing one of the symptoms or the symptoms that have been listed above. Like physical symptoms can be continuous fatigue, continuous headache. So of course, that's why we were saying that if the symptoms persist after a certain length of time, but it's more severe than usual for you, you have to be your own kind of assessor to have to sense that, okay, this is a little bit too much now. Now, if after, let's say, a period of 2-3 weeks, you're still shaken by events, which can be totally normal, but you're unsure, then the best thing would be for you to get the support of a professional, or the advice of, a counselor in trauma, who will be able to guide you properly. But usually it's more about really assessing yourself, because we all have that capacity to know a little bit about what's happening with us. If we haven't experienced, if we're not part of the complex PTSD category of people, then we'll be able to know that there's something that's not quite right. My way of responding and reacting right now is too much, and it's over the top. And that's usually a sign that it's good to seek help. As I said, it won't necessarily mean that you will have a diagnosis of PTSD, even if your symptoms were to persist maybe for a month. It can be understandable depending on the context of the situation. So it's not like a hard rule or a hard fact. Okay, but the best thing would be to seek the professional help and support of a clinical psychologist, psychotherapist, counselors, someone who's trained in trauma, even a psychiatrist.
Yeah, great, thank you. So also there's another question, how can we differentiate between PTSD that is due to August 4 tragedy or COVID-19 effect on us? Like, this is multiple traumas, and maybe it's like, for example, if we hear a loud sound, we will do a reaction that is more usual than what we usually do. Then this is because of the explosion sound, and COVID-19, like the fact that we had to go through lockdown. Is this a trauma, or what do you consider?
It doesn't necessarily have to be a trauma. However, if people have lost families or friends as a result of this illness, then of course this can, and it's happened suddenly, of course these are going to be additional traumas, of course. For other people who haven't been in this situation, we can all still be affected by this pandemic, so to different degrees. But again, it doesn't have to be a trauma. It can be a difficult experience, a difficult event, without necessarily going under the umbrella of a trauma. So a trauma, it's only if it's really hurt me to a degree, or it's frightened me to an extent that I'm being affected and unable to function for a short time, until if it becomes more persistent, then it becomes something a little bit more serious after that.
Okay, great, thank you. We have a question from Lamis. She said she's used to rationalize her emotions in order to understand, process, and liberate them. However, she is not able to associate her fears with what happened on 4 August. And this is adding to the stress, as she's not feeling that she's in control anymore. So can you please tell her if trauma should be handled mentally or emotionally, and if she is on the right track trying to come to realize it, like she rationalize this, you know, everything. So
thank you for the question. Rationalizing is, of course, it can be very beneficial and useful. However, rationalizing sometimes too quickly without other basic steps before, you might find yourself stumbling and struggling because at some point you're just too overwhelmed to be able to continue to rationalize, and your fears will be taken over, simply because simply because there's an attempt of wanting to gain control of your environment, perhaps, which isn't really happening for you. And so you're not really being able to get back your sense of safety that is a foundation and essential for us to be able to process things. The moment I feel safe, and I'm safe within myself, I'm calm, I'm able to have more control over my emotions, then it becomes easier for me to rationalize. But if I'm rationalizing without being able to regulate my emotions, then I'm going to find myself stumbling along the way. So we need to know how to rationalize, when to rationalize, and what to be doing beforehand to support this effort that we're doing.
okay, great, thank you so much. So that's it for now as questions. You can keep like writing your questions in the chat box, and now we will move to part 2, which is more about the recovery, I guess.
Yes, so it's about recovering from trauma. Again, this is the good news, but at the same time, recovery from trauma can be experienced for many as something very scary. A lot of people are afraid to start a therapeutic work in fear that it's going to be too painful. And of course, it can be a difficult process. However, if you're going to be working with a trauma therapist like this, and I will be talking about the various options, the various ways of doing it, it's not necessarily that you have to be reliving or talking again about the details of the trauma that you've experienced. We know that from research, for some people, because it's not a rule for everyone, but for some people, talking about the traumatic event soon after the trauma can actually be triggering in itself. And many people can find themselves talking about the event over and over again, and it being more triggering and more uncomfortable than for other people. So it's about the timing of when to begin to talk about it. There's even debates among specialists in the trauma therapy field whether or not a person has to be talking about their trauma or not, or at least part of it in one way at a specific time. So everybody's different. We need to be able to listen, to learn to listen to ourselves a little bit more. But when we've been disconnected and dissociated because of what's happening to us, it's difficult to know how to handle this and what to do. And therefore, that's why it's important to, first of all, understand that talking about the event isn't something that you are forced to do, or that you are obliged to do, that you have to do immediately, that we can do it at your own pace, at your own time, but more importantly, that you basically start to learn basic skills that will allow you to experience at least safety with yourself, just safety of your mind, safety of your body. Now, of course, for other people, this can be very difficult to do, because feeling safe in their mind and in their body, especially if they've been subject to other forms of traumas, then there's a whole re-education to go through with this, following the similar steps that I will be sharing with you in a moment. So another misconception is this idea that to recover, one has to feel worse. And this is not the case. You don't have to feel worse to recover, and this is not trauma recovery. That's not the point. The point of recovery and the goal of recovery is and must be to relieve and not intensify suffering. Okay, so the guiding principles of trauma recovery are about restoration of safety and empowerment. Again, because we feel helpless, we feel hopeless, we feel like something's been robbed from us, where we are out of control, and there's nothing that we could do about it. So that's why restoring the essential step of safety is so important. We need to know that recovery is not a quick fix, that it is a process, and that process is going to differ from one person to another. It's true that it can be uncomfortable, but it's not there to make you feel worse, and it's not there to scare you either. But the reality is that something has affected you, and of course it's going to be uncomfortable, but the process is about helping and assisting to minimize the discomfort, and then for you to be able to learn to relate to yourself and to what's happened in a different way. And so there are many paths to do that. So as I said before, and that's why I highlighted here on the slide, and I'll repeat it again, is that the goal of recovery and of trauma recovery therapy is in relieving and not intensifying suffering. So there's an order that we know that's going to be most suitable and helpful to go through a process of recovery than another, okay, which again I'll be introducing now. Revisiting the past, that means going back into what's happened and the details, is only a part of the process, and only in the right moment. So it's not about opening the subject up straight away. That would be too much for some people. It would be too overwhelming. It would be too triggering. So it won't be helpful. So earlier I was talking about common sense, and common sense is the foundation of everything. And unfortunately, it's not very common, which is the irony, because especially when we've been through traumatic incidents, we will lose touch with common sense, and there will be like a survival mechanism inside of us that will kick in, which is part of what is also known as the fight or flight response. Whenever we're confronted with a danger, we will do that. But sometimes we will find ourselves not necessarily evaluating the situation in the right way, and that's where we lose touch with common sense, or having a more or rationalizing things in a more constructive ways. And we might find ourselves maybe jumping to conclusions. We might find ourselves overgeneralizing a situation, maybe not really being able to see the positive of situations, and always continuously focusing on the negative, not because we want to, but it's just what's happening to us, and it feels like it's out of our control. So this is really important. Common sense is an important part of recovery, to assist the person in making sense out of what they are experiencing physically and mentally. And this is through a series of psychoeducational steps. By the word psychoeducation, it's just educational steps, informative steps to assist you along the way. So there are key issues that we want to highlight. We want to remind the person who's gone through a trauma that, first of all, and this is the most important point, because a lot of time we are continuously reliving the past. We might just be stuck with it, but forget that we are here still right now, and that you are a survivor. You survived. That means you're here. That's one. Another key thing that we need to be highlighting and being aware of is that the flashbacks that we're having, that means continuously reliving the incident or incidents, is a memory. It's just a memory. And that's a good way of being able to just separate a little bit from the event in order to move gradually towards more common sense. Self-forgiveness is also an important one, because it's very common for many people. And if we're talking about the recent event that happened in Lebanon, not only people who were on site of the explosion, but even people who were far away, and people in other countries who have that sense of, many people that I know also around me were also expressing feeling guilty for not being there. Having this sense that maybe I could have done something, but that comes from our sense of hopelessness and helplessness following a trauma, that there's nothing we could have done, nothing we could do about it. It was out of our control. So self-forgiveness is a very important form of self-talk, and is not easy to do, but again, there are steps to be able to get to that place in order to come to terms. And to be able to accept where you are at, so self-forgiveness. Usually when we have guilt, it's very often associated with shame. So again, self-forgiveness is not only about forgiving oneself so that we don't feel guilty anymore, it's also about alleviating shame. And then shame can be associated to many other things, because again, there's other forms of traumas. If we're talking about abuses, other forms of abusing, difficult experiences, that can also be filled with a lot of shame that can be very difficult to work through, and takes time. Another key issue is making recovery steps manageable. Yes, a routine, a plan, all these things are useful. They're nice words when we use the word routine, having a routine or having a plan. They're nice words, but when we come to therapy, we want to make this even more grounded for a person who's struggling. Okay, so the recovery steps manageable. Is these feelings are going to go away? Are these thoughts going to stop? Am I going to stop having these flashbacks? Will I ever feel safe again? Will I ever be able to walk in this street again? Will I ever be able to have a healthy relationship or a loving relationship without feeling safe? Will I ever be able to trust? These are questions that we all may have, especially when we are having these traumatic incidents. So we need to be working on a plan within the therapy itself, with a goal that is manageable and achievable, so that you begin to, in a very, very gradual way, step by step, acquire the sense of at least the basic foundation of sense of safety within your your sphere, your body space, your own body and mind. So we begin this way so that we can move upwards. By doing this, you begin to move out of this self-defeated state that nothing will ever change. So it's a frozen state, like I'm not moving. It's like I feel deflated. What's the point? And that's, you know, these are kind of feelings and states that we might be struggling with. And when I'm experiencing these senses that, what am I going to do? This will not change. What's the point in me doing this? And I'm really struggling with these thoughts. Then again, getting the right support, and especially you don't have to be struggling on your own. And there are professionals out there who are here for this. They're here to be able to guide, to listen to you, so you don't have to be holding the burden. And sometimes, because of their skills, they're able to help assist you in very quickly by saying one word or one advice that can just change the course of your life experience without having to endure even further unnecessary continued feelings of unpleasantness and shame. So this is another very important key here, of moving out of your frozen and defeated state. If it's difficult to do by yourself, then you can reach out and speak to someone who will be able to sometimes very quickly settle you and make you see things differently. Then another key issue in recovery is ultimately finding meaning and purpose from the trauma, something that is not possible to do immediately. Okay, for some people, maybe they're able to do that quicker than others, to find a meaning behind this event as an opportunity for more growth and something for themselves, or something they want to be achieving for the world. So it becomes like a mission. For other people, this is too far-fetched for them to be able to do that at this point. But ultimately, that's where we're heading within the recovery therapy process. And ultimately is for you to become independent and being able to fully take care of yourself and of your life. Mentioned earlier about our survival instinct. So our fight-flight response. This is a primitive part of us that's very useful. It's an alarm system that allows us to sense danger. However, when we've been exposed to danger and something has been real for a long time, sometimes we're going to find ourselves in a hyper-aroused state, meaning that we're constantly on edge, constantly going to be looking around us. And it has this volume controller that the alert controller in our brain becomes so sensitized that it's difficult to switch it off. So like we're constantly on edge. So this is something we have to learn to regulate again. This is what we call technically in therapy emotional regulation. We learn how to cope and how to manage our emotions in ways that's very tangible. And I'll give a few examples about this as we go through the other steps. So you might again be familiar with your fight or flight response. It's a very good tool. Of course, it's what makes us human, but when it's on overdrive, we have to learn how to regulate it so that we can actually be able to normalize the situation and give way to common sense. Yeah. Common sense, again, a rational way of functioning. Again, it's a step-by-step process. Okay, just a second.
So please feel free to ask your questions on the chat box. We have some comments, like for example, Leah is saying that it's true about the guilt. She feels guilty. And at the same time, she knew that if she was still there, because she feels guilty because she left the country, but if she was still there, her kids and maybe them would have died. So she has a constant guilt. It's really hard to feel this. If you have any questions, please feel free to write them down and we will get back to you. Yeah.
Yes, thank you for sharing this. Of course, this has been a devastating event, and you know, a lot of the time we can find ourselves stuck with reviewing and revisiting what could have happened to us, but yet we forget that that has already passed, and that the reality of now is that you know, you are here, your children are here, that you survived. Recognizing that you have survived is important because it grounds you to the present. You're no longer just in the past, struggling with that. So that's important as a first step. Of course, if you're still struggling with that idea, then I'll be talking right now about the 3 phases of recovery. And like I was saying earlier, the most essential, the most devastating and terrifying experience from a traumatic event is that it robs us from our sense of safety. We no longer feel safe. And without safety, we cannot function. It's like a domino effect. So if I'm trying to function without feeling safe, then there's something that doesn't really work. So I absolutely need to focus on stabilizing this initial first step. I need to recognize that I'm in an unsafe space, so that I don't put unnecessary energy and effort on trying to kind of think in a certain way or constructive way, when at least physiologically and in my mind, I'm unable to feel a sense of safety and peace inside of me, if that makes sense. So people that are affected by trauma, like I said, to feel unsafe in their bodies and to feel unsafe in their relationships with others is common. So we want to regain that sense of safety, which may take days, it may take weeks, especially with, let's say, acutely traumatized people. It might even take some months and years for other people who've been in more complex forms of traumas or ongoing forms of abuse. So we need to be really figuring out what areas of life need to be stabilized, and that will differ from one person to the other. So it has to really be personalized. And how that will be accomplished. So that's part of the therapist's work, is to come up with a plan that will be most helpful to you and adapted and appropriate for you, what we need to be focusing on more. So one of the basic things will be about learning skills and strategies, learning how to regulate one's emotions, how to reconnect with our body. Here I'll be talking in a moment about mindfulness, also breath work, how to feel safe again, maybe through touch as well. So there are various forms of exercises and practices that one can focus on developing in order to establish this first.
The sound went off, Jeremy, or is it just for me? Can you still hear?
Yeah, I can hear you.
Yes, now it's back. Okay, it just went off for a bit.
Okay, so this, as I was saying, for if you didn't hear what I just said in the last moment, I was just saying that establishing that sense of stability and safety is the first step we want to be investing of our time and effort in. So that's phase 1 before we move to the next phase, because the next phase involves remembrance and mourning. So it's only in phase 2 that we can begin to really discuss a little bit more about the event itself, simply because, as I said initially, You know, there's a form of therapy, we call it debriefing, and that's to allow a person to talk about what's happened to them and what's happened in the aftermath of the event immediately after. And for some people, that is extremely triggering for them because it doesn't allow them to settle down. So sometimes a lot of therapists will rush to, you need to talk, you need to talk, you need to talk, but the person is still very much unsettled. So we need to start with the basics of being able to teach them skills that will calm their system down. And when their system is calmer, then it becomes easier to process and to talk about things, to allow the person to talk more freely about what it is that they want to talk about without feeling forced to have to go into details. Again, there's still you know, some differences among therapists in terms of how much does the person have to talk about. Again, for some people, they don't necessarily have to be talking that much about an event, whereas for others, they need to talk about it continuously in order to process it afterwards. So there are some people that approach works. For other people, there's something else that works. So we need just to adapt, and we need to see what works for oneself. So it's important if like you're the sufferer, it's important for you to learn certain skills like mindfulness, and I'll talk about this because that comes down into phase 1. Mindfulness is a very, very powerful and very useful way of reconnecting with yourself, which I'll talk about in a moment. Because once you have that, you can use it as your gauge, meaning it becomes like your indicator, your self-assessor of what's actually going on, how you're responding right now. Is this making me feel a little bit more stable? Is this approach making me feel a little bit more settled? Or am I really suffering a little bit too intensely right now, and it doesn't taste very nice for me? So that becomes your cue. Okay? Because the objective and the first goal of treatment is about helping to relieve symptoms, not add more to them, especially when we're talking about trauma that is already in itself a sensitive topic. Okay, so phase 2, that's when we go into, like I said, remembrance and discussion. Phase 3 is about reconnection and integration. In this phase, there must be, and this can happen naturally in the process, but it's a creation of a new sense of self and a new sense of purpose. So like I said initially, in one of the key issues is as you move further into the stages of recovery, you then enter this stage of redefining yourself. And in the context perhaps of the situation, of meaningful relationships, what it is that you really want for yourself. You have a clear sense of purpose, and that's what we can be working towards as well. So how we map this out for you, how you map this out for yourself. So the trauma, it has become really something that you recognize. You might still be affected by it. It might still be uncomfortable, but it's not as disturbing as it was initially. So there's a lot of people, especially for PTSD, that it's not like they will, the traumatic event will disappear. It just means that their relationship with the trauma will be a different one. It will no longer be something that is a taboo or a stigma. It will be something that I can discuss and talk about. I can recognize that it's uncomfortable if there's a part of the memory that comes back to me. However, I'm much more in control, much more centered. I feel more empowered. I feel safe within myself, and I'm able to develop in my life the way that I would like, whether in my interpersonal relationships with people or in the country or the work that I'm actually doing, and so on. Any questions?
So there are some questions like, for example, babies and kids, how do we deal with them? Because after the blast, they start to have PTSD, like when they hear loud noise or when they like have a door slamming, they feel like the reaction is not proportionate. So they are afraid. Some kids also are talking about like fear of death or not able to sleep. So how to deal with them? We had a session, by the way, about parents and kids, but just because we got the question here again.
Yes, of course. Again, kids will like adults. They will respond differently. So we all have a different type of, capacity of being resilient. And resilience is a way of bouncing back after an incident. Others will struggle for a bit longer with this, and for others it's about developing resiliency over time. So really for kids, then if you're really noticing these symptoms, and they're complaining of not being able to sleep, and they're talking about the incidents, again, it's okay that they're talking about these things. I would suggest that if you're not sure what to say, to do, then to seek the support of a child psychologist in your area. Sometimes having just a few sessions can be really helpful for them. Also, in terms of your infants or babies, if you're noticing that they are crying a little bit more than usual, following a sound or a noise, it's possible that, again, depending on their age, that they're sensing this. We also need to know that infants are very connected to you as a parent, and they will also sense your level of insecurities as well. So if you're feeling insecure, they're going to pick up on that, and of course that's going to exacerbate the thing. So it's more about maybe working on yourselves and giving a bit of time and to this. Now, again, for infants, it's really more about focusing on you as a parent, rather than let's say on the infant itself, because when you're calmer, then your baby will also be influenced positively with that. Of course, being if you can be if you can recreate the safe environment, then and responding, not it's easy, because it's easy when we've in the aftermath of an event, that we are going to be on edge. So meaning that we are going to be on alert. We will be hyper aroused. Remember? So on alert, that means anything can happen again, because I don't trust the environments. Anything can happen again. So that's the atmosphere that I might be spreading inside my house. So I'd like to really, in a way, kind of reconnect with myself to recreate a space that will be harmonious for the yourself to start calming down, and for everybody at home to be calmer. Practicing mindfulness, breath work as a parent with your children, and having them as an activity doing it is a wonderful way of offering that support and helping yourselves to reconnect and to regulate your emotions.
Okay, great.
For another, yes.
There's another question. How can we help someone to seek help? Like some people went through a trauma and refused to go to a specialist, especially if they are struggling with financial issues, and they prefer to keep the money for like, more important things for them, like food or stuff. So how can you convince or like someone who is really traumatized and they need to see an expert, how can we really help them? So
well,
actually, I could recommend there are some free lines like who could help, Embrace and Idrak. They have some free lines you can call and have free help. But some of them refuse. They have a big ego or whatever. They just don't like to get help. So is there any way?
Yes, I would like to repeat what you said. There's definitely a lot of support that you can be getting in Lebanon. Support, I think, voluntary support from these different places that you mentioned. So the help is there. Even if you're financially strained or in a difficult situation, you can still get the help. I myself have been offering my time for people in Lebanon. So that is also something that's been there. So that's not an issue. It's
the issue is maybe him deciding to take the step.
Yes, the issue is there because maybe of many, there might be resistances, and the resistances, we talk about fear. And so the person is maybe afraid to make that step. Maybe they're afraid for many reasons, which is understandable. However, how can we encourage someone like this to do this? Because we cannot force someone. It doesn't work that way. But we can encourage them in indirect ways. Maybe if they seem to be, if they are, for example, complaining of experiencing difficulties, or if they're not complaining, but you are noticing that their reactions are a little bit more extreme than usual at home or in these environments, you could ask the question, you know, I mean, are you noticing what's happening? Did you realize that you're sleeping late, or did you realize that, you know, we can ask them, prompt help them by prompting through questions, to then make them realize that there's something that you can actually get the support for this.
Okay, great, thank you. So we still have 10 minutes, okay? If you have any last question, you can deal. So someone is asking about dealing with a toxic family member, but this is another topic, so we will have another whole topic about that. So, but like maybe if you would like to say a word about it related to trauma.
So the question here is what this is
toxic
about
family member.
Okay, a toxic family member within the form of trauma. Of course, if it's a toxic family member, if maybe we're talking maybe some form of kind of abuse in some way, you know, there's different forms of abuse. I know that the word abuse sometimes sounds very.
Excuse me, so if you, I'd like to talk more about that. I meant if I'm talking to someone as you, I feel abusive and in a bullying way, although he has lived a harsh life, but it's affecting me in a very toxic way, as if like I'm being controlled, even though I don't want to be controlled. I don't know how to explain that. It's really
It's a bit out of topic, but we can maybe answer your question later on if you ask.
What I'll do, I think, if I can have your contact, or if you can maybe send me maybe an email later on, I can answer you, because so that I can just stick with this. But it's an important question what you asked, and I'd like to give you a little bit more of time to be able to answer you correctly. Okay, so thank you for asking that question.
Right, we have a question about therapy, like in trauma. Which therapy is better? Is it like CBT, cognitive behavioral therapy, or another approach? Like, what helps more?
Yes. Okay. So of course. First of all, we'll talk about cognitive behavioral therapy, because that's the most evidence-based approach available, that is the most clinically studied and shows the best results. Now, cognitive behavioral therapy is a world. By the world, I mean there's many techniques, many strategies. And so therapists today, they will be skilled in multiple techniques that are within the realm of cognitive behavioral therapy. So cognitive behavioral therapy is a form of psychoeducation where you are assessing your thoughts and the interaction of your thoughts with your emotions and how that impacts on your behavior. So you learn how to do all this work step by step. But one thing that I would like to talk about is that there's a third wave of therapy that's really come out in the 1990s, and more so even now today, and it's become something that all psychotherapists will be adopting, will be that of mindfulness. So mindfulness is also part of that. It's a third wave of cognitive behavioral therapy, in which we'll be learning very precise techniques to ground yourself, to learn how to bring yourself into the present, to then learn and develop skills of being in the present. So there's different techniques. Grounding is about bringing oneself into the present, whereas meditation, for example, is about being in the present. So there's different techniques here that are very, very helpful following phase 1 of treatment. Breath work is also an immediate grounder, because it brings you away from what's been bothering you into the present moment, so that you can become more settled. You can feel that sense of safety within yourself step by step. That's for mindfulness. But again, mindfulness and cognitive behavioral therapy, they come together, and we need to be aware of this. Self-compassion, being able to understand what self-compassion is, it's part of mindfulness. We integrate this in also cognitive behavioral therapy. As I said, cognitive behavioral therapy is a world. There's many different techniques nowadays, and we can use them we can use them in an integrative way, which is the way that I work myself. I integrate multiple approaches and adapt them depending on the person that I'm actually seeing. So self-compassion is one's able to recognize one's suffering and develop empathy for oneself. Developing empathy, meaning non-judgment towards oneself. That's something that we adopt so that we can move away from feelings of guilt or shame and those kind of emotions. So as I was talking about cognitive behavioral therapy, that's the world. Here we're talking specifically about trauma. There's something we call trauma-focused therapy, which is in steps, very, very strategic. That means it's 3 steps. You learn, first of all, like I just said, in trauma-focused therapy, you learn skills to regulate your emotions. In step 2, you talk about the issue. And step 3, you begin to learn ways of maybe readjusting your way of thinking and challenging your beliefs. And being able to pave the way towards a more meaningful and productive life. So it follows exactly the steps that I had mentioned earlier. Of course, there's other forms. There's acceptance and commitment therapy. There's dialectical behavioral therapy. These are all technical words. You don't necessarily have to know exactly what these are, but these are part of the skills that a psychotherapist will have that will help you. Another very widely studied therapy that has been proven very efficient for many people to use in combination with other approaches is eye movement desensitization and reprocessing. It's a very precise method of eye movement, that you move your eyes in a very specific way with the guide of a therapist. That its mission, its goal is to begin to help reduce the intensity of the discomfort, to reduce the intensity of the trauma that you've been having, so that you can develop a more calmer relation with it. That's a process. Everybody's different again, so it's not a quick thing. We need to go step by step with it. You have other forms of psychotherapies. So again, here you might have can be very useful combinations, especially people who've been through different forms of abuse and who don't know how to connect with their bodies or to feel things in their bodies again, or who are very sensitive to touch or very afraid of another person touching them for different reasons. These are all complementary therapies that can be adapted and used for you in this way. Medication, that's also a resort for people who are very overwhelmed. We can, the psychiatrist, the medical doctor will be, intervening at this level only when we're really noticing that the symptoms are very extreme and you're not able to really benefit from cognitive behavioral therapy process. It's very difficult for you to be able to apply any mindfulness practices, even after many trials. Then this is what we can do, especially if there are other comorbidities. So that means other mental health conditions that you're suffering with. Maybe you have like you're struggling with alcohol, maybe you're suffering with drugs, maybe you're suffering with eating disorder patterns as a ways of coping. So we need to be assessing the situation in a way that's going to be helpful and personalized to you. So medication may be part of this, may be a necessity for your particular situation in order to benefit from the intervention. So here, as a general rule, self-care is important. So having a well-planned routine, exercises, mindfulness practices, yoga, breath work, all these things can be helpful. Having good meals throughout the day, getting the support from your friends, family, doing things that you enjoy, don't stop that, and connecting with nature, going to nature, a little bit from the city, reconnecting at the sea, doing mindfulness practices on the beach, or maybe in your garden, or maybe just in your home. Or if your home is too insecure, then maybe you can go somewhere, maybe in the mountain. There's lots of beautiful places so that you can really reconnect under, the pine trees or the cedar trees or things like this that can be really helpful. So this is one of the one of the quotes, which is a classic quote that many of us do know, but it's good to just refresh our memory that if I'm here, then I'm a survivor. No matter what I've been through, I can be stronger because of it. So what doesn't destroy me makes me stronger. As difficult as it is, we can learn a lot of from a lot of things, from the most difficult experiences. And the irony is, we have a capacity to learn and grow from our most difficult experiences. I myself have been through many difficult experiences and traumas, so I understand exactly all this, and I know it from a personal, what it means to be going through such struggles. But learning how to recover and learning how to do, or how to pave the way towards something better for yourself is possible. But you need to be informed. You need to know what you need. You need to reconnect, okay, because that works for that person, doesn't necessarily work for me. You need to see what works for you. So that's really important, to recognize what does and what does not help you in therapy. If you're seeing a therapist and you're feeling uncomfortable every single time, you feel like nothing's working for you, well, listen to that, okay? Take a step back and maybe try and reassess, and you have other options. Find something that's gonna work for you that you can connect with. That's important. So again, the first and the most important goal of trauma recovery is to improve your quality of life on a daily basis. How can I feel a little bit more safer every day? When I do the breathing exercise, does it calm me? Even for 10 minutes, does it calm me? We want to improve your quality of life step by step. We want it to be meaningful steps. That is really the important thing, and to go one step at a time, not 1 month at a time, or what's going to happen ahead, and go into irrationality about the future. We want common sense, meaning grounding, bringing oneself back to the present moment. And that's how fast we can go. We can only go as fast as one step at a time.
Great. Thank you so much for this very inspiring session. I would like just to remind you that you can check our website, ihavelearned.me/events, for upcoming sessions. We have a session about stress. We have a session about, like I will show you, like we have a session about corruption on Monday. We have another one as well about disaster management, how to deal with disasters. When there's a fire, when there's an explosion, how to be ready. Unfortunately, we have to learn this. And we have a stress and anxiety during challenging time, dealing with the financial inflation. This is a free session. Please make sure you check www.ihavelearned.me/events, and you will see all the lists. You can register for free for the talks, and the workshops are very symbolic as well. You can book. There's one about becoming a freelancer, storytelling techniques. So there are so many options that you can check. I recommend you check it. And you also, actually Jeremy gives very nice retreats in Bali. So maybe when the situation is better, we will visit you in Bali, or we will get to do an event together soon in Lebanon when you're back and when the situation allows it. Also, just a few small things. We may have on the 11th of October Zen and Nature Day. It's a relaxing day in nature. We will have some of the techniques that Jeremy mentioned, like mindfulness, meditation, and many things, and also like a connection with nature just to recharge and to give to ourselves the energy again. So stay tuned on our website, on our newsletter, to know more about what's gonna happen. So thanks again, Jeremy. Thank you all for attending, and hope to see you all soon. If you need anything, you can email us. We will get the email to Jeremy, or you can email him on his email as well. Yes, you were saying something?
Yeah, just one more, just a reminder for anybody who I haven't been able to answer. Please do send me an email, and I'll make sure to answer. That's it. Okay.
Okay, thank you so much, and please take
so thank you very much, Randa, for this. And,
thanks to you, Jeremy, and for sharing your knowledge and taking the time to give us a session from Bali. So thank you so much, and we look forward for more collaborations. I sent you also a link for an evaluation form. It would be great to hear your feedback, and to see you very soon, all of you. So meanwhile, take care and see you soon. Bye.